Hey guys, in this video we'll be talking about the cubital fossa. This cubital fossa has always been a favorite question for the examiners, which they would time and again ask in Viva and as well as in your theory examination. So today let me talk about the cubital fossa. So what exactly is this cubital fossa? So when you see, it is like a small depression that is present anteriorly over the elbow joint. So this is the elbow joint. So anteriorly what we could see as a triangular depression is called the cubital fossa. So this is a definition, a triangular depression over the anterior aspect of the elbow joint. You can say it is a transition between the arm and the forearm. See here, this is the cubital fossa over which this is the arm region and this is the forearm region. So it is a transition between the arm and the forearm. As a result, what do we do? It will be transmitting the structures from the arm to the forearm. Okay, and so this will be conveying some of the important structures between the arm and the forearm. Now what all we have to be studying under this cubital fossa is firstly the borders, which are three in number, the roof and the floor. Okay, so first let us talk about the borders. So this is a medial aspect and this is a lateral aspect. You consider medially it is formed by the pronata teres. So what end of the pronata teres? Lateral border of the pronata teres will be forming the medial border. So though it is present medially, but this is its medial border, this is its lateral border. So medially, the border is formed by the lateral border of the pronata teres, and laterally it is formed by the brachioradialis muscle. Its medial border will be forming the lateral boundary. So hope you get this point. Medially, lateral border of pronata teres, laterally, medial border of the brachioradialis. This is the medial and lateral boundaries, and the base is formed by an imaginary line which will be connecting the two condyles of the humerus. And see, this is the apex. So this is the base, apex, medial boundary and the lateral boundary. So the apex here, if we see this brachioradialis muscle will be overlapping this pronata teres muscle. So this is a medial boundary, lateral boundary, the base facing up, apex facing down. Okay, this is all about the borders. Now when we talk about the roof, from superficial to the deep, first we'll be having skin, subcutaneous fat, deep fascia and the bicipital aponeurosis. What is this bicipital aponeurosis? So bicep muscle tendon, so during its insertion it will be forming a tendon. So during the same time it gives a thin layer of fascia called the bicipital aponeurosis that will be covering the structures, namely the brachial artery and the medial nerve. Okay, so what is this bicipital aponeurosis? It is a fascia which is formed during the insertion of the bicep tendon. So this is all about the roof. And now what about the floor? The floor is formed by the brachialis muscle proximally and supinata muscle distally. So in the roof, you also can find some superficial veins which are clinically very important, namely the median cubital vein, which will be connecting the cephalic vein laterally and the basilic vein medially. So this is the median cubital vein which is seen in the roof region. Now let us talk about the contents. So from medial to lateral, we'll be talking the structures in an order of MBBS. This comes a mnemonic where most of the people used to remember the structures from medial to lateral. The first M refers to the median nerve. See here, this is a median nerve. This will exit the cubital fossa by passing between two heads of the pronata teres. So pronata teres will be having two heads, and this median nerve will be leaving this cubital fossa by passing between these two heads of pronata teres. And next coming B. B refers here to the brachial artery. This brachial artery near the tip, it will be dividing into two branches, the two terminal branches, namely the ulnar artery and the radial artery. Next coming to the bicep tendon. This bicep tendon will be getting inserted to the radial tuberosity. And last S, actually it refers to the superficial radial nerve. So we just normally talk about the radial nerve. Radial nerve at the level of the lateral epicondyle will be dividing into two branches, the superficial branch and the very deep branch that will be supplying the posterior aspect of the forearm. Now, what is the clinical aspect of this cubital fossa? Now, why should you study about this cubital fossa? And mainly it is because of the median cubital vein. So, this is the choice for the venae puncture. Why? Only here the venae puncture has to be done. We have so many veins superficially in the body. Because, so point number one. So point number one is it is present superficially, so it is available easily. And when you are doing the venae puncture, it do not slip because it is attached to the deep veins via the perforator veins. And also, uh, it is easy to available, right? So all these points makes it choice for the venae puncture. And the brachial artery present here, its palpitations are observed during universal measurement of the blood pressure. So while measuring the blood pressure, we'll be mainly monitoring this brachial artery pulsations. Okay, this is all about the clinical aspect of the cubital fossa. Thank you for watching the video. If you really found it easier, give a like, share it with all your friends, and do not forget to subscribe